Welcome back to the Neurophilia Podcast. I am your host, Nooper Goyle. Whether you are listening to this podcast on your way to work, at the gym, or even from the comfort of your own home, we want to thank you for taking some time out of your day to join us and learn more about neurology. In today's episode, we will be discussing neurology and ethics. The relationship between neurology and ethics is a captivating and complex one, as it explores the interplay between the physical workings of the brain and the moral and ethical dimensions of human behavior and decision-making. In the article, Ethics and Neurology, authors Baker and Hughes write, ethical issues are highly relevant in neurology, which has often been a source of difficult cases. The nature of neurological disease means that capacity may be affected earlier than other diseases. Neurology patients may have currently incurable disease and may be vulnerable to unethical suggestions for new treatments. Because of this, it is imperative for neurologists to engage with and be mindful of the ethical considerations in treating patients with neurological disease. In the field of neurology, neuroethics is an emerging career path, with more and more ethics committees, conferences, and scholarly articles, and other training programs available through organizations such as the American Academy of Neurology. Doctors Young and Burnett write, by the virtue of the privileged relationship between personhood and the brain, and the importance of properties of the nervous system to what, for most people, makes life worth living, conditions that affect neurological function introduce a growing host of novel ethical and philosophical issues. Rather than serving a reactionary role, it is important for neurologists to anticipate such issues and develop familiarity with ethical analysis to inform quality medical practice and to safeguard neuroscience research. And I absolutely love this quote because it not only captures the magnificent and large role the brain plays in our overall function and our overall sense of self, but it also comments on this overwhelming ethical responsibilities that come with being a neurologist. And it urges neurologists to take a more central and active role when it comes to ethical considerations in their practice. And so to discuss this and more, I have with me Neurophilia co-host and vascular neurologist, Dr. Blake Bilecko, and two experts in the field of neuroethics, Dr. Paul Ford, Ph.D., and Professor Lauren Sankary, J.D. Paul Ford, Ph.D., is currently the director of the Neuroethics Program at Cleveland Clinic and has more than 20 years of experience providing ethics consultations to patients, research participants, healthcare professionals, researchers, and others. He has authorship on more than 100 publications that range from commentaries to scientific papers. He has a special focus on ethical challenges surrounding neurotechnology and clinical neurology. His undergrad degrees were in mathematics, computer science, and humanities before transitioning to a Ph.D. in philosophy, followed by a fellowship in transplantation ethics. Professor Lauren Sankary, J.D., is currently the Associate Director of the Cleveland Clinic Neuroethics Program at Cleveland Clinic. After completing a 2.5-year neuroethics fellowship at the Cleveland Clinic, Ms. Sankary joined the Cleveland Clinic's Neurological Institute as the clinical ethicist in 2020. She received a J.D. with a concentration in health law and a Master's of Arts from the Case Western Reserve University after receiving a BA in rhetoric from the University of California, Berkeley. Professor Lauren Sankary's research focuses on ethical issues raised by neurological research and innovative neurosurgical invention. Her current research is funded by the Alzheimer's Association, and previous studies have been funded by the National Institute on Aging and the National Institute for Neurological Disorders and Strokes. Dr. Paul Ford and Professor Lauren Sankary, thank you for joining us on the Neurophilia Podcast. It is such an honor to have you both here with us today.
It's a delight to join with you, and such complex and interesting topics that you address. I appreciate having the opportunity to chat.
It's great to be here with you.
Absolutely. Well, I know that over the hour we have a jam-packed schedule, and so I just want to make sure we're jumping straight into this conversation. And the first thing that I wanted to ask you both about, since you have such a focus in neuroethics, is firstly, how did you develop that passion specifically for neuroethics? And can you tell us a little bit about the day-to-day things that you do in your interactions with neurology and neurological patients?
Great. So my interest in neuroethics really started very early in my time at the Cleveland Clinic. I was on the general ethics consultation service. I get a phone call from the operating room. The surgeon says, "Hey, my patient's telling me to stop my surgery. What do I do?" I say, "Put them back to sleep like they're supposed to be, and problem solved." And he said, "No, no, no, you don't understand. This is deep brain stimulation, and we need them awake and cooperating." I said, "Oh, that makes it more difficult." And he has some anxiety. Can can I keep going, or do I have to listen to him? So we worked through that case, and had I not been so new to this field, I would have put some scrubs on and went in and talked to the patient in the operating room. We had clinicians come out of the operating room. We discussed it, and in the end, the patient decided that he didn't want to go forward, and we felt like he retained capacity. And the physician said he knew what he was saying. He had anxiety and really wanted them to stop. So he was 6 hours into a surgery, had had his brain penetrated a few times, and they ended up closing him up without the brain stimulator being placed. And so it's a patient with Parkinson's, so still had the tremor and all those things. And from there, I received invitations, come and help us think through this new technology. It's not a new technology now, but at the time, how do we do this better? How do we avoid this situation? What are the oddities of these complex brains where we have neural pathways that all converge in areas like the basal ganglia, right? Like it's a highway with multiple intersections. I thought at first that the brain was just this part of the brain has one function, this part has others, not these pathways that all intersect. And if you stimulate one part, you may affect a bunch of functions, right? And we can't always predict, and sometimes it's counterintuitive. Are we suppressing function or are we stimulating function? Well, there's theories for both. And how do we help people decide when we can't really tell exactly how it's working, but we know it is? And we can have some paradoxes where we can make things a lot worse without